All right, welcome back to TV5 News at 9, everyone. Time now for Medical Moments with Covenant Healthcare. And joining us this morning, we have Dr. Colleen Linehan. It's good to see you. How are you?
I'm wonderful. Thanks for having me today.
Yes, of course. We love to have you here, and we're talking about shoulder injuries, common shoulder injuries. So just to start us off, what are the most common 3 shoulder surgeries performed in adults?
So the first easiest one is usually shoulder arthroscopy. The next in complexity would be rotator cuff repairs.
Okay.
And then full shoulder replacements.
Oh man, and like what type of injuries, I guess, do you typically see? Like, how do you get a shoulder injury?
You know, a lot of times it can be just generalized wear and tear, especially if you're talking about arthritis and even rotator cuff tears. A lot of people expect there to be a large event or incident that goes along with them. But rotator cuff tears are really most common in the 50 and over population, and often it is not caused by trauma. It's a generalized overuse and wear and tear.
Gotcha. Good to know. So we wanted to get a little bit into these types of surgeries. So can you just tell us first what a shoulder arthroscopy is?
Sure. So arthro means joint, and scope is putting the scope inside the joint. So we can treat all kinds of pathology inside the shoulder by making usually 3, sometimes more, little poke holes through the skin. It can be diagnostic, so we can look in. We have little probes that we can put in there, evaluate what's going on. And sometimes it's as simple as a clean out procedure. Maybe it's some bone spur that you maybe didn't accrue over time, but was even more genetic, or the shape of your bone, so that can be cleaned out that way. And usually with just the shoulder arthroscopy, it's pretty minimal downtime, minimal recovery.
It sounded pretty not invasive.
Correct.
All right, good to hear. So into the rotator cuff, and I've personally heard that this is I wouldn't say intense injury, but it kind of is.
So when the rotator cuff tear is caused by an injury, it often is a much larger tear.
Okay.
So what the rotator cuff is it's 3 main muscles that start around your shoulder blade. They turn into tendons that are like ropes, and they attach in a cuff at the top of your shoulder. They primarily give you use of your arm overhead and out away from your body. So a lot of times when people start losing strength kind of up overhead and out away from their body, that's indicative of a tear in one of the tendons. Typically, if the tendon is just frayed a little bit, or if it's not torn all the way through, we can do conservative management with that.
Yeah.
Sometimes we'll use injections to try and calm down inflammation, physical therapy exercises, and often that can be helpful. But when the tendon is torn all the way through, we do recommend surgery. So surgery involves taking the tendon and basically tacking it down where it used to be.
Wow.
The surgery itself does not take very long. It's always an outpatient procedure, so you get to go home the same day. But unfortunately, the recovery is long. As much progress as we've made in orthopedic surgery, we still haven't been able to get the tendon to heal back to bone much more quickly.
Yeah.
So it's typically a 4 to 6 month recovery, resting that tendon, letting it heal. Sometimes longer if it is more than one tendon. If you tear all 3, that recovery can be up to a year.
Wow. The human body is really crazy. It's so cool. So shoulder replacement surgery, and who's best for that, and does it work?
Yeah, so shoulder replacement is one of the newer relative joint replacements in orthopedic surgery. We started replacing hips back in, the 1960s, so long before my time. Moved on to knees, and then shoulder surgery, as far as the replacements, has really exploded in the last 10 to 20 years. It's one of my favorite surgeries to do. So it's performed for arthritis. Okay. As with any joint replacement, normally the ends of your bones are covered with cartilage. It's almost a frictionless substance, allows your joint, the bones in the joint, to move almost like ice on ice. And as that cartilage wears away, you're left with bare bone. And that is what arthritis is. So I do get the common question, can you just go in and scrape out the arthritis?
Right, that would be nice.
It would be nice, but the problem is your cartilage is already gone.
Right.
So we try and get patients to tolerate their arthritis until it's really affecting their daily life.
Okay.
And then with shoulder replacement, we're trimming off the whatever cartilage is still remaining, any of the bone spurs, and replacing it with metal and plastic. Sometimes we can also do the shoulder replacements. It's called a reverse style for a rotator cuff that's not repairable. So if the tendon tear is too severe, It's too chronic. It's recurrent. People say, "Wait, you mean you put my shoulder on backward?" Not at all. Basically, instead of leaving the ball on the outside and leaving the socket on the inside, we're flipping. Who gets that?
Okay.
And what that allows you to do is use the deltoid, this nice bigger muscle here, to get that overhead strength back when you don't have a rotator cuff.
And you said the shoulder replacement's your favorite. Why?
It is. You know, I do probably at least 150 of them a year, and it really, a lot of my patients are in my more geriatric population also, so it's very gratifying to have, I call them endearingly my little old ladies. You know, they'll come in their 80s and 90s, and they have a hard time, you know, reaching toward their hair, they can't reach behind their back. And again, the surgery is even quicker than rotator cuff repair. The surgery in my hands takes about a half hour, and the recovery is quicker.
Okay.
I'm not waiting for the tendon to heal. So they typically get a nerve block, so the arm is kind of numbed up and paralyzed the day of surgery, which is great. That means no pain when they wake up in the recovery room. I start letting them use the arm the next day, so the day after surgery, unlike the rotator cuff repair where you have to fix it. So the recovery is somewhat accelerated. A lot of it happens within the first 2 months.
Okay.
A lot of patients tell me that even the day after surgery, their pain is already lower than what it was the day before, and sometimes their function is already improved, especially with the reverse style when their rotator cuff has kind of left them.
That's great, and you know, changing lives for the better. That's great. So if anyone is experiencing maybe any issues with their shoulder or pain, and they have questions, where should they direct those to?
So there's a lot of information on my website. My website is basically my name.
Okay.
It's drcolleenlinehan.com.
Okay.
So drcolleenlinehan.com. And you can also go on Covenant's website. We have a lot of orthopedic surgeons there, myself included, who would love to take care of them.
All right, Dr. Linehan, thank you for your time this morning. This is a great conversation.
Thank you for having me.
Absolutely, my pleasure. And if you want more information on today's topic, just make sure that you head over to the Hot Links page on our website, WNEM.com.